How to protect yourself from colon cancer when you're under 55. Colon cancer, also known as colorectal cancer, is one of the most common cancers in the world. According to the American Cancer Society, there will be an estimated 104,270 new cases of colon cancer and 45,230 new cases of rectal cancer in the United States in 2021 alone. While colon cancer is often thought of as a disease that affects older adults, it can also occur in younger adults. In fact, the incidence of colon cancer in adults under 55 has been increasing over the past few decades. This article will provide tips and strategies for protecting yourself from colon cancer when you're under 55. 1. Know your risk factors. One of the first steps in protecting yourself from colon cancer is to know your risk factors. Some factors that increase your risk of developing colon cancer include: 1. A personal or family history of colon cancer or polyps. 2. Inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. 3. Genetic conditions such as Lynch syndrome or familial adenomatous polyposis. 4. Obesity and a diet high in red and processed meats. 5. Smoking and heavy alcohol consumption. If you have any of these risk factors, it is important to talk to your doctor about how to reduce your risk and to get screened for colon cancer at an earlier age than recommended for the general population. 1. Make lifestyle changes. Making lifestyle changes can go a long way in reducing your risk of colon cancer. Here are some tips. 1. Eat a healthy diet. A diet that is high in fruits, vegetables, whole grains, and lean proteins and low in red and processed meats can help reduce your risk of colon cancer. 1. Additionally, it is important to limit your intake of alcohol and sugary drinks. 2. Exercise regularly. Exercise can help reduce your risk of colon cancer by promoting healthy bowel function and reducing inflammation in the body. 2. Aim for at least 30 minutes of moderate intensity exercise most days of the week. 3. Maintain a healthy weight. Being overweight or obese can increase your risk of colon cancer. 3. By maintaining a healthy weight through a healthy diet and regular exercise, you can reduce your risk. 4. Quit smoking. Smoking is a known risk factor for many types of cancer, including colon cancer. 4. Quitting smoking can greatly reduce your risk. 5. Manage stress. Chronic stress can have a negative impact on your overall health, including your risk of colon cancer. 5. Finding healthy ways to manage stress, such as exercise, meditation, or therapy, can help reduce your risk. 1. Get screened. Getting screened for colon cancer is one of the most important things you can do to protect yourself. Current guidelines recommend that adults at average risk of colon cancer begin screening at age 45. However, if you have any risk factors, your doctor may recommend screening at an earlier age or more frequent screening. There are several different types of screening tests available, including: 1. Colonoscopy. This is the most accurate screening test for colon cancer. 1. During a colonoscopy, a doctor uses a long, thin tube with a camera on the end to look for polyps or cancer in the colon. 1. If any polyps are found, they can be removed during the procedure. 2. Fecal immunochemical test, FIT. This test checks for blood in the stool, which can be a sign of colon cancer. 2. It is a non-invasive test that can be done at home. 3. CT colonography. This is a type of CT scan that produces detailed images of the colon. 3. It is less invasive than a colonoscopy, but still requires a bowel prep and can miss small polyps. Talk to your doctor about which screening test is right for you. 1. Know the signs and symptoms. Knowing the signs and symptoms of colon cancer can help you catch the disease early, when it is most treatable. Some common signs and symptoms of colon cancer include: 1. Changes in bowel habits, such as diarrhea, constipation, or narrow stools. 2. Rectal bleeding or blood in the stool. 3. Abdominal pain or cramping. 4. Weakness or fatigue. 5. Unintentional weight loss. It is important to note that many of these symptoms can be caused by other conditions as well, and not everyone with colon cancer will experience symptoms. However, if you experience any of these symptoms, especially if they persist for more than a few weeks, it is important to talk to your doctor. 1. Understand the importance of follow-up care. If you have had a screening test that showed no signs of colon cancer, it is important to continue getting screened on a regular basis as recommended by your doctor. Additionally, if you have had a colonoscopy and polyps were found, it is important to follow up with your doctor to ensure that any remaining polyps are monitored or removed. 1. Be proactive about your health. Finally, it is important to be proactive about your health and to advocate for yourself. If you have any concerns or questions about your risk of colon cancer, talk to your doctor. Don't be afraid to ask questions or to seek a second opinion if necessary. Conclusion. Protecting yourself from colon cancer when you're under 55 requires a combination of lifestyle changes, screening, and proactive healthcare. By knowing your risk factors, making healthy choices, getting screened, and staying vigilant about your health, you can reduce your risk of developing this disease and catch it early if it does occur. Remember, early detection is key to successful treatment and a positive outcome.